Sometimes it all starts with little things. You're standing on the toilet and notice your stream has weakened. Or you wake up in the middle of the night for the third time that night and realize you need to get up again. Or you're going fishing with friends and you're thinking not about the bite, but about where the nearest toilet is. It seems like a small thing. It's part of age. It happens to everyone. So what? I got up a couple of times. At least I drank some water before bed. That's how men live, without complaining, without talking, without getting checked. And then, a couple of years later, they suddenly come to an appointment and say, "Doctor, everything would be fine, but I can't sleep at night. My blood pressure is fluctuating. I have no energy." And then begins the conversation that many people avoid their entire lives. I can always tell by a man's eyes, he's uncomfortable. Talking about his prostate is like admitting weakness. We're used to the idea that strength lies in silence, that a real man endures, that you don't even tell your wife about such things. But after 20 years of practice, I've realized silence destroys faster than illness. The prostate is not a shameful topic. It's part of the male anatomy, as natural as the heart, lungs, or liver. But for too long, it has been hidden behind shame and jokes. And because of this, thousands of men waste years of their lives in fear, instead of simply addressing the issue early. I've seen a wide variety of patients: athletes, businessmen, drivers, teachers. Many of them came when the inflammation had already become chronic, when pain had set in, when potency problems had begun. And almost everyone said the same thing: if only I'd come earlier. Why didn't you come? Because you're embarrassed. Because a friend had it and it went away on its own. Because the doctor will start doing something unpleasant. Because I'm not an old man. But the disease doesn't care how old you are. After 40, the prostate begins to live by its own rules. And if you don't understand these rules, you can very quickly find yourself in a situation where neither sleep, nor work, nor intimacy bring you joy. I know this is a sensitive topic, but let's be honest. A man isn't just about muscles and character. He's also a body that demands respect. And if we take care of our hearts, monitor our blood pressure, and count calories, why should the prostate be any exception? It's responsible for more than just urination. It's a gland directly linked to our hormonal balance, libido, and self-confidence. When it's functioning well, a man feels alive, calm, and strong. When it's inflamed, everything collapses: mood, sleep, energy, desire. But this is rarely discussed, because a man who admits to having problems down there seems to lose some of his dignity. But in reality, he's only gaining maturity, the courage to take care of himself. You'd be surprised how often chronic prostate inflammation hides behind an outwardly prosperous life. Sometimes a man appears successful: work, family, car. But inside, he's tired, irritable, and feels like something's squeezed out of him. He blames stress, age, sleep, whatever. But in reality, it's a small gland the size of a walnut that's to blame. I often ask patients, would you ignore pain in your heart? Of course not. Then why do you tolerate pain when urinating? The answer is usually the same: yes, I thought it would go away on its own. And this phrase is the most dangerous, because at 40, it doesn't just go away on its own. The body doesn't get any younger. The metabolism slows, and inflammation festers for years. And if you don't help the body in time, it starts screaming through pain, through insomnia, through decreased libido. I understand men. I used to avoid doctors myself. I thought if it doesn't hurt, everything must be fine. But health isn't the absence of pain. It's inner peace. And it's often the prostate that's the first to disturb that peace. Waking up several times during the night isn't getting older. Feeling a heaviness in your lower abdomen isn't being too cold. When your desire for life and intimacy has diminished, it's not losing your spark. It's body language that says, pay attention to me. I don't want to scare you. I want you to stop being embarrassed. I want you to understand, getting your prostate checked isn't shameful. It's a responsibility to yourself and those who love you. To your wife, to your children, to yourself. A man who cares about his health is not a weakling. He is mature. He doesn't run from the truth. He simply wants to live without pain, without anxiety, with a clear head and a calm heart. And if this conversation prompts at least one of you to make an appointment with a urologist, then it will have already saved someone's life. Because prostatitis isn't a death sentence. It's a signal that it's time to stop, breathe, stop enduring, and start listening to your body. Today I'll tell you simply in a human way, without medical horror stories, what happens to the prostate gland after 40, why men remain silent, and how to make this conversation not shameful, but liberating. So let's get this straight, without the medical jargon. What the heck is a prostate? It's a small gland about the size of a walnut. It's located just below the bladder and surrounds the tube through which urine exits. If you imagine the bladder as a balloon, the prostate is the ring at its base. A tube called the urethra passes through this ring. When the prostate is healthy, it's soft and elastic, and urine flows freely through it. When it becomes inflamed or enlarged, the ring tightens. And then it all starts. The stream weakens, you have to strain, and you need to urinate repeatedly, especially at night. But this is only the external aspect. What's happening internally is far more important. The prostate produces a secretion, a special fluid that nourishes and protects sperm. This is part of the male hormonal balance. When it is inflamed, not only urination is disrupted, but also the reproductive system and even the psycho-emotional state. Have you ever noticed that when your back hurts for a long time, your mood gets worse? It's the same here. When the prostate is inflamed, the body lives in a state of constant internal stress. Cortisol levels rise, testosterone levels drop, and a man begins to feel different. Not the same. He wakes up tired. He gets angry for no reason. He loses interest in life and intimacy, and he thinks he's getting old. But in reality, he's simply experiencing a chronic inflammatory process that can be stopped if he pays attention in time. Why is this happening? The reasons are simple, and most of them are habits that we don't even notice. A sedentary lifestyle. We sit for hours behind the wheel at the computer, on the couch. Blood stagnates in the pelvis, and the prostate suffers from a lack of oxygen. Hypothermia, especially in winter when men like to sit on cold concrete or go fishing without thermal underwear. Infections. Sometimes inflammation is caused by bacteria that enter the genitourinary tract. Stress and lack of sleep. Yes, the psyche and prostate are more closely connected than you might think. An irregular sex life. Long breaks or, conversely, excessive activity without recovery. All of this affects the gland. Simply put, the prostate doesn't like it when a man sits, gets angry, is cold, and is silent. It prefers the body to move, the blood to circulate, and the person to live without constant internal tension. How do you know when it's time to pay attention? Here are some signs you shouldn't ignore. Frequent urge to urinate, especially at night. A feeling that the bladder does not empty completely. Weak or intermittent stream. Pain or burning when urinating. Heaviness or discomfort in the lower abdomen, perineum, or lower back. Decreased libido, erectile dysfunction, premature ejaculation. Increased irritability, fatigue, sleep problems. If you've identified at least 2 of these conditions, it's time to stop making excuses and get checked out. Because the sooner you start treatment, the faster and easier your recovery. I always ask, why did you come only now? And the answer is almost always the same. I hoped it would go away on its own. But the body isn't a magician. It can compensate, tolerate, and adapt, but not indefinitely. When a man endures pain or discomfort for years, he's not showing strength, he's wearing himself out. The prostate is closely connected to the nervous system. When it's inflamed, the brain receives constant alarm signals, and you start to feel anxious out of nowhere. Irritability during the day, insomnia at night. You feel like your life is dimming. And then come problems with family, work, and self-esteem. Thus, illness of the body turns into illness of the soul. What can be done? The first thing is to stop being afraid of the urologist. Modern diagnostics are painless. Tests, ultrasound, a consultation, and you already understand what's going on. Often treatment is limited to mild lifestyle changes and a course of gentle medications. Sometimes we add physiotherapy or massage if needed, but all of this is done delicately with respect for the body. Second, exercise. The prostate loves blood flow. Walk at least 30 minutes a day. Replace your evenings on the couch with light exercise. Swimming, cycling with the right saddle, and stretching are all excellent helpers. Third, maintain a healthy routine. Get at least 7 hours of sleep and drink less alcohol, especially beer, which puts stress on the urinary system. And of course, drink plenty of clean water. Fourth, have regular sex. The prostate needs to be functioning properly. This is natural drainage, natural prevention. Fifth, emotional balance. Chronic stress disrupts hormonal balance. If you feel constantly tense, find a way to de-stress. Exercise, meditation, a walk, or talking with a loved one. A prostate exam doesn't make a man weak. It makes him responsible. Every time I see a patient smile again after treatment, get a good night's sleep, and feel alive, I understand. All they needed was a decision. I've seen men who came when they were already really down, and within a couple of months they were back in shape. Because the body's grateful. It always responds when it's cared for. What happens if left untreated? Chronic inflammation is like a smoldering fire. Mild discomfort today, pain tomorrow, complications the day after. It can lead to the development of adenoma, a benign enlargement of the prostate that compresses the urethra. Sometimes surgery is necessary, and sometimes the inflammation becomes so severe that potency and the entire genitourinary system are affected. But this can be avoided. No miracle pills or secret supplements are needed. All you need is knowledge, attention, and a little discipline. If you're listening right now and recognize yourself, don't be alarmed. You're not alone. Millions of men are going through the same thing, and almost everyone who takes the first step later says, I wish I had done this sooner. So don't wait until things get really bad. Do it for yourself, for those around you, for a good night's sleep and the peace of mind that your body's okay. The prostate is not the enemy. It's just a reminder. It's time to take care of yourself. You know, over the years, I've realized one simple thing. A man can endure a lot pain, fatigue, loneliness, silence. But what he fears most is appearing weak. We spend our entire lives proving to someone that we can handle it, at work, in our families, in sports, even to ourselves. And then suddenly there comes a moment when the body begins to speak to us in its own language, quietly, without hysteria. It's just a pricking sensation somewhere, a pressing sensation somewhere, something that doesn't work as well as before, and we hear it but pretend we don't, like later. Now's not the time, and then a week drags on, a month, a year, and one day the realization comes, it's time. I've seen hundreds of men come into the office with this feeling. At first there's wariness, an awkward smile, an attempt at humor. Then relief when they realize they're being treated not as a patient, but as a person. Because the truth is, a mature man isn't afraid of weakness. He knows how to work with it. Many of you live at a frantic pace. Work, family, responsibility. You're always needed by someone. But you know what I tell my patients? If you don't need yourself, then one day you won't be able to be needed by anyone. This isn't selfishness, it's maturity. When you pay attention to your body, your well-being, your peace of mind, you don't age. You reclaim your life, energy, and confidence. The prostate isn't a death sentence, a shameful topic, or a symbol of aging. It's simply a part of the male body that, like everything else, requires care. It doesn't ruin your masculinity. It's simply a reminder of it. How many times have I heard from men after treatment? Doctor, I'm sleeping normally for the first time in years. Doctor, I feel like a man again. Doctor, I now realize that there's nothing wrong with me. And every time I smile, because I see more than just improvements in my test results. I see a person returning to themselves, to their strength, to their confidence, to their life. If you're listening to me now and feel a deep resonance somewhere within you, just take a step. Don't wait for the pain or anxiety to intensify. Don't make excuses. Find the cause and address it. The prostate isn't a weak spot. It's a place where your body asks you to stop and listen to yourself. And if you listen, if you don't ignore it, you'll gain much more than just health. You'll gain inner peace. A man over 40 isn't a youth chasing after new experiences. He's someone who's already understood that the important thing isn't speed, but the quality of the journey. And taking care of your body isn't weakness. It's respect for yourself, for life, for those around you. You know, many illnesses thrive on silence. They thrive where people are shy, where they procrastinate, where they remain silent. But health is born of honesty. It's about saying to yourself, I need to take care of myself, and I will do it. When you decide, you're already halfway there. The rest are just steps, a checkup, a consultation, a regimen, small habits. 5 minutes of attention a day can change years of your life. And finally, I want to tell you what I always tell my patients when they leave the office. You haven't gotten older, you've gotten wiser. Because maturity isn't wrinkles or gray hair. It's the moment when a man begins to truly understand himself, to listen to his body, not argue with it, to nurture himself, not give in. And if you can take even one step in this direction, you've already done more than most. Take care of yourselves, friends. Don't be shy about taking care of yourself. After all, a strong man isn't someone who tolerates everything, but someone who knows how to stop, listen to himself, and choose life.